Hey everyone, welcome to the channel. If you're into simple, helpful content, be sure to subscribe. We make videos that are easy to follow and worth your time. Let's get started.
Understanding the incubation period for COVID-19 during community transmission is crucial for public health. The incubation period is the time between exposure to the virus and the onset of symptoms. For COVID-19, this period can vary significantly among individuals. However, public health agencies have established clear ranges. The most common incubation period for COVID-19 typically falls between 2 and 14 days. This range has been consistent across various strains and community settings. Most people who develop symptoms will do so within 5 to 7 days after exposure. This average is a key metric for guiding isolation and quarantine guidelines. Early variants like Alpha and Beta generally had a slightly longer average incubation. Later variants, such as Delta and Omicron, showed some shifts. Omicron, for instance, often presented with a shorter average incubation period. Many studies suggested an average of 3 to 4 days for Omicron. This accelerated timeline impacts how quickly the virus can spread. It also affects the effectiveness of contact tracing efforts. Community transmission refers to cases where the source of infection is unknown. In such scenarios, understanding the incubation period becomes even more critical. It helps public health officials estimate potential exposure windows. This knowledge informs decisions about widespread testing. It also guides recommendations for mask wearing and social distancing. The variability in the incubation period means some individuals might become infectious before showing symptoms. This is known as pre-symptomatic transmission. It is a major challenge in controlling outbreaks. The incubation period is distinct from the infectious period. However, they are closely related. A shorter incubation period can lead to faster cycles of infection. This can accelerate community spread. Factors influencing an individual's incubation period include their immune response. The viral load they were exposed to also plays a role. The specific variant of the virus is another significant factor. The Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, continuously update their guidance. These updates reflect ongoing research into the virus's behavior. They also consider the characteristics of emerging variants. For practical purposes, public health advice often uses the longer end of the incubation range. This ensures a wider safety margin. For example, a 10-day isolation period after symptom onset is common. A 5-day isolation period after a positive test is also frequently recommended. These periods account for the typical incubation and infectious windows. Knowing the incubation period helps individuals make informed decisions. It guides them on when to get tested. It also tells them when to isolate themselves. This protects family members and the broader community. During periods of high community transmission, rapid identification of cases is essential. Understanding the incubation period assists in this rapid response. It helps to break chains of transmission effectively. Thank you for watching. Please like this video and subscribe to our channel for more vital health information.
Thanks for watching. Please like and subscribe.